And are there any questions regarding Personnel Committee?
No. Steve?
I have one.
While we're waiting, I just wanted to point out I'm looking at it now. The policy, under review tab, you can read every policy that's currently under review.
On the website?
Yes.
Thank you,
on the
Mrs.
website.
Cullen.
On the personnel meeting, my question is on item number 2. I would like to know if that is a budgeted item. If it is not budgeted, I would like to know where the funds will be coming from. And have you dropped something else from the budget to make room in the budget for this expenditure?
Thank you.
Yes.
So then we're actually going to reverse the order. Is that for the executive? Okay. So we're going to start with number 2. It's a recommendation to add the learning support teacher .4 at Igler, .6 at Seiler to accommodate an increase in student population. Mrs. McHale, would you like to speak to that?
The increase in student population is for students who've been identified into the special education program, and the numbers right now are high enough that they warrant an additional teacher, and that's in accordance with federal guidelines. And I've asked Mrs. Burkholder to stay in case there are any additional questions regarding those guidelines. Oh, right. We did have a change in the percentage. It is going to be 0.4 at Diagler and 0.4 at Seiler. Originally, we had 0.5 and 0.5.
That's 0.8.
These positions are mandated through the state and federal regulations, and we do have money in the budget that is in Mr. Daubert's contingency fund for cases such as this when we have to increase a staff member due to student population increase.
Thank you. Any questions from board members?
I have a question about where it comes from in the budget. So there's nothing in the special, that's related to special ed that would come from there? No.
No, so when staffing was done last year, they did it based on caseload numbers and enrollment projections. So hires and all sections filled at the beginning of the year met those requirements. But with new identifications, we've now gone over those legal requirements, and we don't have a choice but to add. So the budget, it was not budgeted in the special ed Department of Pupil Services at that time.
And when will the person start after the December board meeting, or do they need to start immediately because we already have too many people? How does it work?
So we would have to post, interview, and then hire, and then they would be able to start. And if that timeline, once those students are identified, because they've now been identified through an evaluation report, once they actually have an IEP with a NORC signed, if we don't have somebody hired, we have to put a substitute in until that point.
So is that what we have a sub in now?
No, the IEPs haven't occurred. This is all new information, which is why we're increasing. So the evaluation took place first. So we know an IEP is coming, and they've met the requirements for eligibility.
Okay, so that's still in the works as well, so we still have some time.
Correct.
Okay, all right, thank you.
And I just want to add that when this occurs prior to the board actually authorizing the position, often we'll post it as an anticipated position.
Thank you. Anyone else? Then the second item is the Wellness in the Workplace Program presentation, Mrs. McHale.
So I'm very pleased that tonight we have with us Mr. Rob Nicoletti, And he will be presenting to us his company's wellness program that we're hoping to launch after the first of the year. We're going to start putting together a committee and get things underway. Mr. Micheletti comes highly recommended. He has done work in the private industry as well as with other school districts, and he's going to give us a short presentation on what his company has to offer. Yeah, I think we're all going to have to kind of move around because he's going to do a short PowerPoint.
There you go. So did a lot of presentations on here. So just pick the ones at Pennridge.
Rob, do you have any numbers up for you? Do you need one? I'll have one.
Oh, I have one. Excuse me. So I'm just going to give you a week or something. Okay. So I'm just going to talk loudly because I have a loud voice. My name is Rob Micheletti. I am the president and founder of Wellness, Nutrition, and Education. And certainly I want to thank you for having me here this evening. What we're here to talk about is providing a wellness program for Pennridge School District. If you follow along with me, the first we've outlined an agenda for you. And so we're going to talk about an introduction, benefits of wellness in the workplace, proposed services, participation strategies, and endorsements, and basically our contact information. So these are the things that we're going to discuss in introducing our organization. So who is Wellness, Nutrition, and Education? Well, first of all, we're an organization that's headquartered in Paoli, Pennsylvania. We also have another office located in Pottstown, Pennsylvania. And we service many different types of organizations, whether it be for-profit, nonprofit, and public sector in providing wellness services all over the Mid-Atlantic region. I myself have been a healthcare consultant for over 30 plus years, and I started this company in 2010 because it became very clear to me that one way for us to develop long-term strategies to contain healthcare costs was to address the actual subscribers or the employees within groups' actual behavior, okay? And the best way to do that is in a wellness program. So what we're looking to do is address behavioral change for individuals and institutions through education, coaching, and positive reinforcement. All right? The next thing I did when I was looking to start this organization was I had to analyze who are the best qualified providers to provide this service. And so in my review and analysis of looking at all the backgrounds that I was looking for, I decided that registered dietitians were uniquely qualified based on their education and experiences to provide the services that I wanted to provide to our customers. The programs that we address in behavioral change starts with stress management. If you think about it, it's stress that every one of our lives, and I'm sure all of us have that same thing, whether it be we're trying to be the best parent that we can be, whether I have financial concerns, whether I have pressure from work. That all leads to a lot of the other issues, whether it be weight issues, whether it be other issues. So I think stress is such an important issue to address. Weight management, certainly another area we're addressing. Exercise motivation. We also address nutrition education and tobacco cessation, okay? These are probably the 5 targeted areas that we address when we do wellness programs. Go ahead. So the concept that we came up with is wellness in the workplace. One of the biggest problems with wellness is that there's many barriers to having a successful wellness program. And one of the biggest one is getting people to come. People have busy days, and then they have to go deal with their families. So if we can bring the wellness to where they are, which is at work, we're going to be so much more successful. And so that's why we've determined with the philosophy of wellness in the workplace. And we get the employers and the management team to buy into this philosophy. One-on-one health coaching. So one-on-one health coaching really comes down to the basis of behavioral change. We do many things. We do wellness workshops. We do hot topic sessions. But when it comes down to it, it's meeting that person where they are, meeting with them on a one-on-one basis. Every person has different issues that they want to discuss and start with. I may want to deal with tobacco cessation. Another person wants to deal with stress. And so our health coaches works with each person and meets them where they are to start to develop the stages of change. So we also provide the complete coordination and implementation of wellness services. So a lot of times what we find is we bring certain things from our toolbox, but then we're also coordinating with other organizations that you might already be dealing with that also has a toolbox that we're going to help coordinate for you. There's a lot of organization, coordination, facilitating of bringing many resources together to provide a wellness program. And you need to always reiterate it, because I've seen many organizations start a program, everybody gets excited about it, but it's continuing it over a long period of time where you actually have long-term change that's going to benefit the organization. Okay, so what are some of the benefits of a wellness program? First of all, we're going to talk about benefits for the individual. The benefits for an individual to participate in a wellness program is to prioritize for each individual their physical and mental health. It's amazing to me, and the more that longer that I've been in this business, I've realized that everybody's striving to be the best administrator they can be, or the best soccer coach that they can be, or the best teacher that they can be. But if they don't have health, they're never going to be any of those items. And if you think about healthcare in general, most people don't even think about their health until, I had a heart attack. I better do something. I better lose a lot of weight, okay? But it actually should be just the reverse. You have to put yourself first. And so that's part of what we're addressing and getting people to understand that you need to deal with this first. Reduce stress and anxiety is part of what we're doing on a day-to-day basis. We explore ways to transform personal wellness goals into realistic action steps. We boost energy and sense of well-being. We receive support in managing health conditions or disease risk. There's many people who have serious health conditions that we can help them address. Diabetes is a typical one, okay, where a health coach can work with these people on a one-on-one basis to make sure that they're properly managing these diseases. Increase motivation, accountability, and sustaining healthy lifestyles. So a lot of times people start a process, but they don't follow through. So that reinforcement that you get from working with a health coach on a one-on-one basis is so important. From an organizational standpoint, there are many benefits. The number one item is lower healthcare costs. Number two, decrease absenteeism. Number three, increase productivity. If people are healthy and they're feeling good about themselves, they are probably going to be better employees. Increase employee retention. They feel good that their employer is providing a service for them that helps them feel better about themselves. They might feel better about coming to work. Increase camaraderie amongst coworkers. A lot of times you have peers working together and doing walking challenges. And so then they start having that camaraderie as coworkers. Overall, encouraging healthier employees. Okay? So W&E designs a wellness plan to meet employer and individual needs. So what I'm basically stating here is that we can cater a program to meet any organization's particular need. We have some general ideas and concepts that we want to deliver, but these things are very malleable and we can cater them to your needs. But to the core of the service that we want to offer to Pennridge is one-on-one health coaching. And what is one-on-one health coaching? Well, first of all, you have to identify each individual's needs. You need to see where they are in the stages of change. Each individual is at different levels or different place of where they want to go in addressing the stages of change. Then you start to set up goal setting. What am I trying to get accomplished? Support, accountability, and feedback. So that's why you don't just do this once. You're doing this on a consistent, long-term basis. The other thing is services can be offered different ways. We certainly like to start off doing it on a face-to-face basis, but a lot of times to fit into people's lives, we may be using tools such as telecommunication, we might be using Skype, we might be doing this many different ways to deliver the service to help fit into people's lives. Okay? So the next thing I want to talk about is, well, how are these services going to be provided and who are some of the vendors that we're going to work with in helping deliver the service? So my understanding, if I'm correct, is that Pennridge contracts with Independence Blue Cross for the employee benefit programs here. Whether you know it or not, your programs provide 6 nutrition consults per year for every employee, for every dependent, and it's available to them at no cost, no copay, okay? And so it's a very valuable benefit that most employees probably don't even know they have this benefit, okay? That's my experience from being in this business a long time. W&E is a participating network provider for Independence Blue Cross. We also are participating provider with many insurance carriers, whether it be Aetna, whether it be United Healthcare, Cigna. We are participating providers with many commercial carriers. We're also, with Independence Blue Cross, a certified tobacco cessation program provider. Okay? Next slide, please. So I talked about individual one-to-one health coaching, but there's many other things that can be delivered. And so I just want to touch on those for a minute. When you talk about a comprehensive wellness program, other areas that we might want to consider are setting up wellness committees, okay? A wellness committee is basically made up of a cross-section of employees from your organization. It's not just management. We want somebody from every different committee that is going to serve as a person that's going to spur interest, talk to their fellow employees about what the program's all about. And we're probably going to meet quarterly and just have an overview of what things are going on, what are our goals, what are we doing well, what do we need to do better, that kind of thing, okay? Health risk assessment. Well, basically, this is basically a tool where you're evaluating the risks associated with the employees in your population, okay, and their dependents. It tends to be HIPAA compliant, okay, and information is then given back to the employees and what type of programs they might want to participate in based on the information that comes out of a health risk assessment. Biometric screens is a tool where you can evaluate particular potential problems. You know, you're looking at looking at people's cholesterol levels, you're looking at seeing what their high blood pressure levels are, what their obesity levels are, so on and so forth, so that you can provide immediate documentation to employees and reports of areas where they may need to work on immediately and what programs they want to get involved with. Wellness workshops. So wellness workshops is a tool where we might have 12 different subject matters that we want to address, but we're not going to do it in just one session. This tends to be a group session, and over a period of time, we might have 6 sessions on cancer prevention, okay? We might have another 6 sessions on heart health. We might have another 6 sessions on weight management, okay? And so these tend to be sessions that are over time, that are maybe once every other week. With a lot of employers, we can deal with this on a teleconference basis. Sometimes we do it in a seminar type basis, okay? To differentiate educational hot topic sessions are a one-item program, okay? So it's just one time, you deliver it maybe at something like a all-staff meeting, and it's really designed to generate interest in wellness overall. We use hot topic sessions to educate employees about one particular matter in one 30-minute session and get them to be interested to get involved in wellness. It's almost like a generate interest in wellness program, you know? And we do it by talking about how to be healthy with, you know, very little time. Or how to eat healthy on a low budget, you know, that kind of thing. You address small topic matters, you do it in 30 minutes, and you're looking to generate interest to get involved in the program. The other thing we get involved in is often organizations like to have health fairs. So we will manage the health fair. We will get involved in getting other organizations here. We'll get involved in getting the organization together, getting a lot of different other vendors and providers involved, so that we get involved in that type of activity as well. Okay? So as I mentioned earlier, one of the biggest barriers of wellness is participation. And I can look at any organization, and I'm going to start out with this many people, but participation will go down to this level, okay? And so what we need to do is start off with how are we going to provide incentives, encourage people to get involved. It's the hardest part. So a couple ideas that we use is, number one, is do people know that they can take advantage of health coaching, have it covered 100% with no copay, okay? And that it's going to be provided where they are at their workplace. Just education. That's a key. The number 2 is probably the biggest item. Management support for wellness participation. I know if I go into organization and if I don't have management support, it is not going anywhere, okay? I just know it. I've done this too many times. Creating group contests with incentives, team building. So we do walking challenges, Strive for 5, which is all about eating 5 vegetables or fruits a day, okay? Go ahead. The other thing as far as to create participation, we try to make it easily accessible. You know, that's all about wellness in the workplace. We're going to bring it to you. You don't have to go anywhere. You don't have to go to another location after work. We're bringing it to you, okay? Flexible hours. My health coaches are going to work around the clock on different hours. They can meet people in the morning, they can meet them at lunch, they can meet them after work, that type of thing, okay? Communicate during in-service days and on-site health fairs. Promote individual wellness topics through hot topic sessions. Okay? The other thing that we do a lot of is we work with your vendors and we look them to get involved in providing incentive items. Okay? So some of these incentive items might be water bottles, pedometers, might be classroom supplies, It might be a raffle where we're raffling a tablet or a Fitbit or a spa gift certificate, okay? Sometimes it's a gift card. Sometimes it's just as simple as casual dress day, okay? Every different organization has different items that work with them, okay? And it's part of getting to know each organization and what motivates the people that work there. But you'd be surprised how many people will be motivated for a $50 gift certificate, okay? So the other thing is making it easy to coordinate and have strategies to organize it, okay? So what we try to do is have a very easy appointment setting approach. So we do online scheduling, and also the tool that we use provides an automatic 24 hours in advance reminder of it with an email of when their appointment is, okay? So we're coming to a close here, and I'm just going to go over this next item. Just is a slide that's it's hard for you to see it a little bit, but these are endorsements of different individuals and organizations that have dealt with us in the past who are stating some of the positive experiences that they've had with us. One says the exercise motivation workshop was very helpful and effective. I've been able to successfully increase my workout sessions from 2 to 5, 3 times per week, okay? So just a rough idea. The last slide is just going to be my personal contact information. I'm Rob Nicoletti, the president of Wellness, Nutrition, and Education. We're out of Paoli, Pennsylvania. That is our web address, and also you can follow us on Facebook. Anybody have any questions for me? Go ahead.
The common question, how do you measure the
So first of all, how you can measure is that you document all the services that are being performed, okay? You work with employees in setting their goals, and that one-on-one relationship with a health coach is actually tracking, did I improve on the amount of times I'm working out this week? How much weight did I potentially lose? All depending on what they're working on, you know? Was I able to quit smoking? You know, very documenting these items is not that hard, okay?
right, yeah.
I will tell you one thing, though, is this is not a this is not a fix quick situation. It doesn't happen like that, okay? I can tell you that wellness is a long-term commitment, and through repeated process of being involved, do you see real change. And that could be a 3-year
Oh, yeah.
situation, 3 to 5 years.
I was wondering if you have any data on how, if you said that there's reduced absenteeism, those kinds of things.
Can you speak up, please? I can't hear.
I was just wondering if he has information on other places you've done this.
Mhm.
Do you have information on how they reduce their absenteeism and all those sorts of things?
I'm sure I can provide some of that information. I don't have it right with me this second, but I'm sure I can provide some of that information if that's something you want to look into. Be happy to share. Okay.
Yeah, along with that, I mean, lower healthcare costs.
I can't hear you. You're not registering at all on here.
Okay.
So her question was, along with that, lowering healthcare costs, okay?
Enhanced productivity in the workplace.
So, wellness is hard to measure, okay? Very hard to measure. But at the same time, there are ways that we can, you know, show how those things are accomplished. It takes a long time. My understanding is that it's a self-funded health insurance program, okay? And my experience is that having a self-funded program is the most efficient way to pay for healthcare costs, especially in a large organization where claim costs are what's called credible, okay? To have a self-funded health insurance plan without managing the claims by having a wellness program is something that we really need to nurture because, in my experience, that is a tool that is going to really help control those healthcare costs, the claims, okay?
Thank you,
All right, thank you so much.
At the beginning of this
school year when Dr. Radigan gave her address to the faculty, to the whole faculty. One of the areas that she emphasized was staying healthy, taking care of yourself. It's not, you can't be stressed all the time. You have to be in a healthy state of mind when you come in for your students as well as for yourself. So I thought it was very important this year to launch the wellness program with the help of Mr. Micheletti to sort of tag on to Dr. Radigan's message at the beginning of the year as well. And as I said, he does come highly recommended. I've been in touch with some of the schools that he's in, and they can't say enough about you. Wonderful testimonies and the support that your wellness coaches have been providing to that school and the nutritionists. So I thank you for coming in. And
Well,
does
thank
anyone
you.
have any additional questions?
I have one quick question. On the page where it was about one-on-one wellness coaching, you said that Pennridge School IBC contract
Okay.
and 6 nutrition consults per year. So do you contract as part of through IBC? Like, are your services
Yeah, so our services, just so
coming
it's
to
clear.
us as part of our IBC contract?
That's right. So the bottom line is, as a provider for Independence Blue Cross, we are paid for them.
Okay.
Okay, through the current contract that you have, okay? And obviously, if you're a participating provider with an insurance company, they get a contracted rate that is significantly more cost effective than, buying on the street.
So your service is just part of our...
It's really part of your insurance program, yes it is.
Okay.
But it's probably something you're not using that much.
No, obviously, nobody's really aware of it.
Nobody's aware of it,
Yeah.
that's right.
So is the basic just the 6 nutrition consults per year?
Mhm. And it's funny thing is that we work with many Blue Cross organizations that have that as a carrier, as well as other companies that have, other carriers. But it's amazing to me when an individual has 6 free, okay, no copay cost for the employee, okay, how they don't take advantage of all 6 in a year's time, okay? And so that's where I think you've set up an incentive program where if you do all 6 visits a year, guess what? You get this, which maybe is provided by another vendor. Or maybe it's something that we negotiate with Blue Cross to provide as an additional service that they bring to the table. There's many
So-
different ideas that you can deliver.
The things such as like the health fair and that, then that's in addition to these 6. How does that, like...
So
how
actually
does
what
that
we're going
happen?
to, how do we bring that to the table? So basically from our organization standpoint, we're looking to be endorsed as your wellness provider, okay, for Pennridge School District, just as we are at other schools, okay? And so in doing that, we're going to provide additional services such as being here to help manage and establish a good health fair, okay? And bring in many other vendors, maybe people who provide yoga services or chiropractic services who really want to be in front of your employees, okay? But getting that all coordinated and organized sometimes, is a hard thing to do if you don't have somebody outsourced who does that for a living, It's also amazing how the things that we can get out of your vendors, like you might have 5 different insurance companies who would be happy to also get involved and help provide some of these incentive items that I've talked about, okay? Because it benefits them and also they're looking to further develop their relationship with the organization, okay?
Rob, could I also tag on there for the board that we also have a bank of what's called wellness credits with Independence Blue Cross that will help support, say, the biometric screenings or the health fair if we need to push some money into some of those services. That will come from Independence Blue Cross, and they have already committed to a certain amount of funds for this year, and we possibly may even be able to obtain some of the funds we didn't utilize last year. So we also have that on the table to help support this plan as well.
And we do have a unique relationship with, let's just say, Independence Blue Cross to help even negotiate utilizing some dollars that might not have been used in the past
To
Okay.
set up, to do other events?
to do more things going forward.
So there wouldn't be any cost?
There's no explicit cost to your organization, no.
Basically an unused...
It's something that we're going to take advantage of. Let's just put it to you that way, okay? All right. Well, thank you so much for having me. I don't mean to take too much of your time.
Thank you.
All right.
USB, that's why I moved it. I'm sorry. I didn't just said yeah, no, that was fine. It was closer to it. All right. That was fine. It made it closer to it. That was good.
Okay, well, whether there needs to be a vote or not from the board, we're going to get clarification from Mr. Cox just to find out for certain. And that way we'll have full clarification.
Right, because we would be looking for the board's support in engaging Mr. Micheletti's company and launching this wellness program.
And you'll, when he sends the information about from other districts, the documented results, like reduced absenteeism and lower healthcare costs, you'll forward that to us.
Certainly.
Okay, thank you.
Any other questions from board members? Okay. Then the last is any questions from the public? Seeing none, then the next meeting is scheduled for Wednesday, January 11, 2017. So personnel is adjourned.